Over the years, you've heard me ask wealth manager Warren Ingram the big questions. How do we invest wisely? How do we protect our family's future? All those conversations, that entire library of financial expertise is now available as a podcast. Straightforward advice to help you build your wealth on demand. Just search for Warren Ingram's Personal Finance wherever you get your podcasts.
702
Health and Wellness.
And we get into our health and wellness feature now. And today we are focusing on epilepsy in children. I mean, this is a common neurological disorder globally affecting 70 million old people. In fact, up to 90% live in low income and lower middle income countries, and over half of these are children. So we're trying to understand epilepsy in children. So if you have a child with epilepsy, I'd like you to share your experience on how you've been managing that. Maybe you have some questions around how to deal with epilepsy in children, or there's certain medications you've been trying. Are they working? Are they not? What concerns do you have based on how you've been managing it for your child? 011-883-0702 is the number to dial. The WhatsApp line is 072-702-1702. Dr. Futhi Mahlase is a paediatrician who's going to guide us through this chat. Dr. Mahlase, thank you for your time. Good morning.
Good morning, Clement. Thank you for having me.
So let's start by explaining to our listeners, what is epilepsy in just simple terms, and how common is it among children in this country?
So epilepsy is a neurological condition, so it affects the brain and how the brain functions. So basically what happens is that the brain will get sudden bursts of abnormal electrical activity, and these can cause seizures. In children, it's actually one of the most common chronic neurological disorders, and about 2 per 100 children in South Africa live with epilepsy.
So, how do we then manage? Do we manage it differently when it's a child as opposed to when it's an adult who's dealing with it?
Yes. So the treatment between children and adults is different, solely because with children, epilepsy or seizures are happening on a brain that's developing. So one, you must first be able to identify them so they may not present the same in children as well as adults. And then also in terms of treatment, this is typically done it's almost individualized, depending on the age of the child and their weight, and also the type of seizure. That's how we tailor-make the treatment for the child.
And what are some of the known causes of a condition like this, especially in children? Are there any genetic or environmental factors at play?
So yes, there are genetic causes. So those ones we'll see early on, especially like just after the baby has been born. And also you can see them when there's some brain injury, like for example, if it's a baby that was born and had issues just, with the either prolonged stage of labor or what we call neonatal encephalopathy, previously known as asphyxia. So those would be the children that would have or at risk of seizures. Some children would be in the premature babies that have had bleeds, like major bleeds. Those ones can also have seizures. And also if they have infections like meningitis. And then also children that have had head trauma, or sometimes babies that are just born with their brain that hasn't been properly developed. Also some parts of the brain are missing. Those can cause seizures. Sometimes the cause is really unknown. And then some environmental issues are more related to access to care early on, and as well as nutrition.
Yeah, and we'll get to nutrition in a moment about what's advisable for children who are dealing with this condition. But once a child has been diagnosed, what does treatment usually involve? Especially because sometimes you've got parents who say, we've tried this medication and this child still gets lots of seizures. So is there a specific medication that you start with the children? Are there options that are available? Maybe should one work and not the other?
Yes, so there's a couple of options that are there, like I mentioned, depending on the age and the type of the seizure, and also depending on the cause. So we usually tailor-make. There are standard sort of protocols of treatment that will start the child with. And then if maybe one agent doesn't work, sometimes you end up with children that may need more than one agent. So there's newer agents that have been developed for children. But the best thing in terms of what works for your child or what doesn't entails that you actually see a health professional like a pediatrician or even a neurologist, a pediatric neurologist or a pediatric neurodevelopmental specialist. Because like I said, depending on the cause and the age, certain medication will work for the child and some will not, especially the more complicated ones, like for example, the children with genetic causes. But sometimes what we find is that the treatment itself is not adequate for the child's age. For example, children grow rapidly. They get growth spurts every now and then. So being in regular contact with your doctor, they'll be able to monitor your levels of the blood. Most of the drugs are able to monitor the blood levels just to see that is it actually sufficient for this child or not. And sometimes when you are on treatment and you keep having seizures, it might be that you're actually experiencing side effects of that drug. So then your doctor will be able to sort of maybe either change that medication or, alter your dose depending on your need. Yeah.
Okay. And then you mentioned nutrition earlier on. What's advisable to be part of a nutrition of a child that's got this condition?
So essentially what we advocate for is a well-balanced diet, for children in general. And then when they have seizures, there are particular seizure types where maybe the patients may be advised to maybe go on a ketogenic diet. Some will have, for example, carnitine deficiencies where you just then need to supplement the carnitine in their diet. But generally we advocate for, a well-balanced diet.
Yeah. All right. I've got some messages coming through from some parents who are sharing their experiences. Some who've got questions as well. So we'll go to them after the break. It's 15 minutes now before 12 o'clock. If you have a child that has epilepsy, how have you managing that? And if you have tried some medication, maybe they're not working, you've got questions around how to better manage your child's epilepsy, give us a call right now or send a WhatsApp voice note. 011-883-0702 is the number to dial. 072-702-1702 is where you can send your WhatsApp messages.
702 Health and
12
Wellness.
minutes before 12 o'clock, we are understanding epilepsy in children this morning on our health and wellness feature with Dr. Futhi Mahlase, who is a pediatrician. I want to take your calls though now on 011-883-0702, WhatsApps as well. Let's start with Humeria, who's calling us from Lenasia. Humeria, good morning.
Good morning, how are you?
I'm all right, thank you. Go ahead.
Good, thanks. So I have an 8-year-old little girl. She was diagnosed with epilepsy at the age of 2. She was then put on medication, several medications which did not help her. Medications such as Epilepsy and Ketra. She was then put on Top-Lap. So for the past 4 years, her epilepsy was controlled on Top-Lap. And then suddenly, about a few months ago, the epilepsy started again. So she's currently on Top-Lap and lamotrigine. It's been controlled. But my question is, the medication she was on, her epilepsy was controlled for 4 years. Why suddenly the episodes appeared again?
Oh, okay. And what was the time? So you said he's 8 years old now, right?
She's currently 8 years.
She's 8, okay. And then when did they come back after having tried initially the medication?
So she was epilepsy free for 4 years on Top-Lap.
Yes. Oh, yeah. Okay. All right. Humeria, thank you so much. Dr. Mahlase?
Hi, Samaria. So there are several reasons why this may happen. So one, it could be, like I mentioned, children, the brain is still growing, but also there may be other, as the child is growing, there may be other changes as well, especially if it's a girl. And remember, around 8, 9, 10, some will even be going into puberty or adolescence, which we're seeing puberty, because we're seeing it quite earlier now. So those are some of the reasons why the medication that she was on may suddenly stop working. But, usually it's better to actually have a discussion with your neurologist or your pediatrician to just have a look and see. I'm actually glad that now, they've managed to find a combination that actually works for the child, because at the end of the day, that's what you need, to find what works for the child at that time.
Okay. Thank you for that, Dr. Futhi. Let's go to some messages here on the WhatsApp line. Someone says, Clement, my child was born prematurely, so he has this epilepsy. I have tried everything. I don't know what to do anymore. Nothing works. What's the best way to manage it? And which doctor can you suggest? So Dr. Mahlase, is there a specialist that you would advise this listener to go to? Must you go to a paediatrician? Do you go to a normal doctor? Who's best to assist you, a parent who's got a child who's been struggling with this?
So I would say a pediatric neurologist would actually be the best doctor to see, or a pediatric neurodevelopmental specialist. But unfortunately, we have so few, and you might find that their appointment times are maybe 3 months or 6 months apart. So then your first contact would be a pediatrician, just to sort of, work out what they're currently on, what they've been on. And, sometimes while even waiting for that appointment, the pediatrician is able to liaise with the pediatric neurologist as to what, can be tailored for that child while waiting for the appointment.
Okay. And then Moisi on Twitter says, Clement, my daughter had a first seizure in her sleep at 14 years. Second, 6 months later, she was put on Keppra, where we noticed regular episodes all in her sleep, and severe mood swings as well. Neurologist kept increasing dosage until we decided to take her off meds. It's now worsening. We're now 45 days without that medication since. The suggestion I'm getting from this listener is that when the dosages were being increased, it was just worsening, and that's why they've decided to take her off the meds. Is that the best thing to do?
Actually, no, that's not ideal, but I can understand, as a parent, you're frustrated, you're seeking help, and the person that you're in contact with, has solutions, but they just don't seem to be working for your child. I prefer that, they always go back to the doctor to say, we've increased doses. What are the options? Like I mentioned, there are several medications that this child can be on. And also, in terms of testing, we're not sure if they've done other testings, because sometimes, there are several tests that you need to do, from blood work to even an EEG, and also for, a brain scan, just to see. That might give other clues to, for this child, particularly to say, why is the child specifically continuing to have seizures despite being on treatment and despite the dose being optimized? Because usually when we're increasing the dose, it's more to optimize the dose and see if that will work or not. And if that doesn't work, there are other agents. Some children will need double agents, some even more than one agent. And depending on where the source is, for example, if it's just from one side of the brain and nothing is controlling the seizures, you've been on multiple drugs, sometimes there is actually a surgical procedure where they end up just removing that part of the brain. If, the sole source of the seizures is that part of the brain. But I understand the frustration, and sometimes you just, want to let go and not use treatment that you see is clearly not working. Would advise the mom to, either go back to the doctor or seek a second opinion. I mean, sometimes, we, depending on where you're going, like, if you're a GP or a pediatrician or wherever that you go, you might find that you're going to someone who's not that well experienced in seizure management, or, that's all they know. That's all the only drug that they know. So sometimes seeking a second opinion is also important.
And just lastly, someone is asking about what to do when the child is experiencing this seizure. I've seen someone who experiences seizures that gets really terrifying. You just don't know what to do. What's your advice to parents who witness that? What can they do?
Okay, so the main thing is, we always say remain calm. Even if you do like a basic life support, they say remain calm. But if it's your own child, it becomes very, distressing. But the main thing is that if, you see that they're falling or they've actually fallen, you just need to see, to remove any objects that may be dangerous. Like, for example, if they're near a pool or, the sharp objects around. So you lay them on their left side preferably. And then if the seizure is continuing, you can also lay maybe something soft under their head so that they don't keep bumping themselves. The main thing is to try to protect them from the injury, and then, one person can time the seizure. If there's another person, the other person can call for help, like for an ambulance or something like that.
Mm-hmm.
What not to do is do not restrain them and don't put anything in their mouth. And also don't leave them alone. Like I mentioned, you need to, the positioning, for example, sometimes you find that they froth in the mouth.
Yeah.
So if you position them lying up, they may choke on that saliva. But if they're on their side, at least the saliva can come out. Yeah.
Okay. Dr. Futhi Mahlase, a paediatrician, thank you so much for guiding us through such an important conversation.